I think now we can start. Shall we record also the meeting, Tomais?
Yes, I will record it.
Yeah, so just... Okay, great. So welcome everyone, and sorry for the delay. This is a new lecture by the ProGender project. I would like to say a few words to welcome you about the ProGender project, and just to give you an idea of what we've been doing so far. And most of you, many of you may have already visited our web pages or attended previous events, but some of you might be new, so we would like to invite you to join us in future events. ProGender is a project that aims to promote different understandings of the gender challenges that the COVID-19 virus has brought forward, and to open debates between the three countries that are involved in the project, Greece, Iceland, and Norway, regarding the gender equality in times of the pandemic, in the times of the pandemic. So we have been trying to address several issues: gender care and labor, gender-based violence, women and gender in science, women in governance, and gender and communities. And today's event is related to this last theme, gender and communities, and specifically on migration issues and gender. The title of the event is Migration and Motherhood, the Experiences of Southern European Mothers in Norway. And it will be given by Raquel Herrero-Arias, who is Associate Professor at the Western Norway University of Applied Science. The discussion will be coordinated by Sofia Moratti, who's a senior researcher at the Center for Gender Research at the Center for Technology and Society at the Norwegian University of Science and Technology, who is a member of the ProGender team. So welcome, and thank you very much for accepting our invitation. Sofia, I will give you the floor now.
Many thanks, Nelly. Welcome, everyone. Nelly has already introduced me. I work for the Norwegian partner of this project, which is NTNU, the Norwegian University of Science and Technology. And I work in a department that consists of Center of Gender Studies and a center that studies technology in society and innovation. And I am affiliated with the Center of Gender Studies that is directed by Siri Sørensen, who is the scientific coordinator of the ProGender project for us, from our side. You have introduced Raquel Herrero-Arias. She's a social anthropologist. I may say a bit more about her. Her research interests are parenting and migration, especially migration. She has been investigating migration in Norway from multiple viewpoints, migrants and the welfare state, relationship of migrants with the maternal care services. At this time, she has a project on foster care for children with a migrant background, again in Norway. And her talk today will be based on her recent publications, multiple recent publications by her. One is The Emotional Journey of Motherhood in Migration, the case of Southern European mothers in Norway, which appeared in 2021 in Migration Studies. Second publication is COVID-19, Information Access, Trust and Adherence to Health Service Among Migrants in Norway, which appeared in 2022 in the Archives of Public Health. And finally, The More You Go to the Mountains, the Better Parent You Are. Migrant parents in Norway navigating risk discourses in professional advice on family leisure and outdoor play. That appeared on Health, Risk and Society in 2020. She is the co-author of all these papers. So she has very solid expertise on parenting, migration, specifically in Norway, and specifically when it comes to the Southern European people as a group. So I think she's the perfect person to have today, and I'm very glad that she accepted our invitation. So Raquel, the floor is yours.
Thank you. Thank you, Sofia, for this presentation. And thank you very much for inviting me to join this very interesting discussion. So I will share my screen so you can see a PowerPoint presentation that I have prepared. Yes, can you see it? Yes. So the topic for today's lecture is migration and motherhood, as you can see on the slide. And I will present some of the findings of my doctoral project, which was a qualitative study about the experiences of Southern European parents raising their children in Norway. I must say that this is the first time I'm presenting this to a Greek audience, so I'm very excited about this opportunity. This is like very, very interesting for me. And at the end of the lecture, I will present also some slides where I will talk about migrant mothering in the context of the COVID-19 pandemic. But first of all, so in order to introduce you to the topic of motherhood and immigration, I would like to present a very short overview of the literature on this field. So Roberta Rafaeta, she did a literature review on studies on migration and parenting, where she discussed that research has traditionally drawn on psychological and biomedical perspectives to explore parenting practices among parents who come from non-Western countries and are raising their children in a Western society. So we see that the focus has been so much on the tensions resulting from the conflicting childbearing ideals and childbearing practices that migrant parents experience due to divergent cultural values, divergent cultural ideals around childhood, around gender, around family, between host and origin communities. And we also see that the literature has put the focus so much on the challenges that migrant parents encounter in raising their children in a new country. For example, the exhaustion of raising children without family support, also the economic and time constraints that this group of parents face, and the sense of losing parental control resulting from this cultural clash in parenting practices from host and origin communities that I mentioned earlier. For example, there are studies that have discussed that migrant mothers avoid disclosing their opinions about the mothering practices that they consider appropriate because they are concerned about being judged negatively by the host community. So as I said, the focus on research has been so much on challenges that migrant parents face, but there are authors who have also identified opportunities that migrants encounter when they are building a family in a new country. For example, migration can mean new opportunities to achieve a desired lifestyle. And an example of this could be a study from Giorgio, who argued that the working conditions and the family-friendly policies that Italian women encounter in New Zealand give them the opportunity to fulfill their professional careers and also their desire to become mothers. And so, as I said before, and as Sofia also said before, my doctoral project was about the experiences of Southern European parents in Norway. So in order to give you some context, I will present now the context of parenting in Norway regarding family policies and parenting norms, and also the Southern European context regarding welfare state and migration to Northern Europe. So the Norwegian context of parenting regarding the welfare state. I think that it's important to mention that Norway is an example of the so-called social democratic welfare state regime, which is a welfare state regime characterized by the promotion of equality, state responsibility for citizens' well-being, and high levels of decommodification and of social trust. In Norway, the state's involvement in family life is accepted, And also children's well-being and protection are considered a societal responsibility. In this country, we see that discourses on children as individuals with their own rights have been particularly strong. So this means that children are considered individuals with their own rights and legal protection, and this further legitimates public interest and intervention in family life. Norway, as well as the other Scandinavian countries, is known for family-friendly policies and gender equality. For example, parents, when they become parents, when they have a baby, they are entitled to a paid leave of 49 or 59 weeks, depending on whether they choose to receive full of their salaries or 80% of their salaries. So this is what we call like the parental leave or the parental benefit period. And after this period, childcare is extensively, public childcare is extensively used by parents. And those parents who prefer home care for their children, they are entitled to an allowance or tax deduction for expenses related to hiring a babysitter. So this was like the context of the Norwegian family policies and welfare state. But as for parenting norms in Norway, research indicates that Norwegian parenting norms are in line with intensive parenting. Intensive parenting is a term that has been coined to refer to the dominant contemporary ideology of child rearing in Western society. It was Sharon Hayes, she was a sociologist, and she was the first one who coined this term of intensive parenting. And she described this ideology according to which the methods of appropriate child rearing are constructed as child-centered, expert-guided, emotionally absorbing, labor-intensive, and financially expensive. So intensive parenting would be like the ideal of parenting in Western societies. And this term refers or mirrors like this process that we have experienced in the last decades of intensification of parenting, meaning that raising children today encompasses more and more activities and more responsibilities that were not considered inherent to this task before. And researchers in the field have discussed that this ideal, that intensive parenting is guided by middle-class values, like, for example, ambition, individuality, aspiration, and the time and the economic demands that this ideology puts on parents make it difficult for poor parents or working class parents to live up to this ideology. So according to intensive parenting, parenting is constructed as a set of skills that parents need to learn from experts, because this is based on an assumption, this is based on an idea that what parents do is too important to be carried out just by trusting their instincts or trusting common knowledge. And researchers have also discussed that intensive parenting is consonant with neoliberal ideals of individual responsibility, because intensive parenting puts so much the focus on parents' responsabilization rather than state responsibility for social problems. And to illustrate this, I will refer to family policies. So we see that in the last decades, family policies, rather than addressing the structural conditions that parents face when they are raising their children, these policies focus more and more on training parents into good parenting, assuming that this is the key to preventing and solving social problems like poverty, unemployment, or social exclusion. And we see this trend in Norway also, where in the last decades, we see an increase in programs that focus on parents' skills as compared to other measures that address parents' socioeconomic situations. So that was the Norwegian context. And now I will briefly present the Southern European context. But first, of course, I would like to say that Greece, Italy, Portugal, and Spain they are different countries that have their own specificities, and we could spend hours talking about their own specificities, for example, regarding the regionalization of political institutions, or but at the same time, these 4 countries have been considered an entirety for analytical purposes in studies on welfare state, also studies on migration, and studies on family. Naldini described the Southern European welfare state as a family kinship solidarity model, where family members, mostly women, and not the state nor the market, are seen as the main providers of care due to social norms about family relations and roles. But I think that it's more complex than that. I think that, of course, social norms about family relations, social norms about gender play a big role here, but research has also shown that the interaction between cultural values, religion, gender roles, but also macro structures like housing and labor markets, all these factors influence welfare state configurations in Southern Europe. For example, the strong family ties have been identified as a causal factor for, and also an outcome of, the low involvement of the state in welfare provision in these countries. So basically this means that because there is a low state care provision, families provide care to the members who need it, but also because families provide support and care, the state doesn't intervene that much. And in these countries, we see late emancipation of youth, we see intergenerational care, also spatial proximity between generations, and these are responses to unemployment, responses to the failure of the housing market, and also to the low state provision that I presented before. For example, in Spain, we see that the provision of care by grandparents is more common than in any other European country. So family ties are very central in Southern Europe. However, there are authors who have discussed that there is a contradiction between this familism and the fertility rates of Southern Europe, which are the lowest in Europe. Explanations for this include the lack of public provision, which reinforce dependence on intergenerational family care. And of course, this is gender, right? So this hinders female participation in the labor market and also affects fertility. Spin Andersen, in his book, The Incomplete Revolution, he discussed that Southern Europeans experience a mismatch between their aspiration to have children and the family policies that fail to help them reconcile parenthood with their careers. And as a result, we see in these countries a delay of motherhood. For example, in Spain, Spanish women reported that they have their children about 5 to 7 years later than when they first considered ideal. And the reason they gave for that was that for them it was very difficult to achieve this work-family balance because of the low state provision. And reconciling work and family life appears even more difficult in Southern Europe since the financial recession of 2008. I think I don't really need to present this economic crisis, but I just will say that this recession was followed by high unemployment, austerity policies, and of course a deterioration of the living conditions of the populations of these countries. Between 2008 and 2013, the rates of unemployment in Greece and Spain tripled to almost 27–30%. And youth unemployment rates reached more dramatic proportions. In 2015, youth unemployment rates in Spain were 49%. Actually, Spain was the country with the largest immigration flow in Europe between 2008 and 2012. And of course, this economic crisis resulted in more intra-European south to north mobility. There were many Southern Europeans who decided to migrate to Northern European countries. And this was motivated by the financial consequences of the recession, but also by other reasons, like, for example, political dissatisfaction due to corruption, career prospects, also the desire to achieve a better quality of life or to get emancipated from the parents' home. In Norway, so many of the Southern Europeans who migrated to Norway after the economic crisis of 2008, they were young, highly educated, unemployed professionals who were looking for ways to cope with the consequences of the recession. Spaniards are the largest Southern European group in Norway, with a bit more of 6,000 residents. And this group is followed by Italians, Greeks, and Portuguese. Greeks have around 3,000 residents in Norway. So now let me present you my doctoral study. So the participants of my study were 15 mothers and 5 fathers from Greece, Italy, Portugal, and Spain. But for the purpose of today's lecture, I will focus on the data that I collected from the mothers, since the topic is migration and motherhood. The participants were between 30 and 46 years, and they had lived in Norway from 3 to 14 years, and they had 1 to 3 children. And apart from one who was single, all of them were either married or cohabiting with a partner from Southern Europe or from Norway. And as you can see here on the slide, participants were diverse in terms of education level, from completed primary school, completed upper secondary school, to university level education. Most of them, 14 of them, so a great majority, they had university level education. However, 5 participants who had university degree had not succeeded in finding a job in their professional fields, in finding a job suited to their education after migrating to Norway. And they were either unemployed or they were working in more working class occupations. I collected the data in 2017 and 2018 through 2 focus group discussions with migrant mothers and 14 in-depth interviews with both mothers and fathers. And the research questions of this study were addressed through 3 publications, the ones that I mark here. And I will draw on these publications to give my lecture today, as Sofia mentioned earlier. However, based on the data from my study, I also co-authored other 2 publications that addressed migrants' experiences with maternity care and also primary healthcare services in Norway. Great. So the mothers who participated in my study, they stressed that they were living in a country with policies that support their family projects. And they describe their family projects as gender egalitarian, nuclear, dual earner, dual carer family model. It's true that they didn't count on support from family in Norway. I mean, only those who were married or cohabiting with Norwegian partners and who had their in-laws nearby had some family support. But most of them, they didn't have that. However, they shared that the welfare state provision and the family-friendly working condition that they encountered in Norway allowed them to be more involved in their children's upbringing and also to reconcile motherhood with their careers. But I mean, this was possible for those mothers who had succeeded in finding a middle-class job, for those mothers who had the mothers who could get access to these family-friendly working conditions were the mothers who had succeeded in finding a middle-class job, who had a permanent contract. But those who, for example, were working in a more unstable situation, those who were, for example, what we call here in Norway, vikar, so on-call employee, who work in order to substitute other workers who are on parental leave or who are sick. Of course, they had more challenges to assess this family-friendly welfare state provision. So for them, this family-friendly provision was just an illusion. The mothers perceive that mothering norms in Norway and also in Southern Europe are in line with intensive mothering. However, they reflected on the existence of some cultural values and understandings of children, childhood, and family that they see as different across these societies. For example, they shared that their cultures of origin stress more children's vulnerability and dependence, and also the reciprocal responsibilities between family members. Also, they identified a more obedience-based and protectionist mothering practices in their countries of origin as compared to that of Norway. On the other hand, they associated Norway with a focus on children's autonomy, children's self-sufficiency, individuality, and children's rights, which were promoted through child-oriented and dialogue-based practices. And this clash in child-rearing practices and in childhood ideals was particularly experienced by the mothers when they interacted with educational institutions in Norway, like, for example, kindergartens and schools. So I must say that in Norway, children aged 0 to 5 go to kindergarten. Well, actually, it's more, the majority is from 1 year to 5, because the first year of life, babies stay at home with their parents who have this parental leave. As you can see in these pictures, kindergartens in Norway are what we know by forest schools or outdoor kindergarten. These are kindergartens that focus on activity in nature, where basically children are all day playing, all day exploring, going on excursions, and they engage in child-led activities rather than more adult-led activities. So to make sense of this clash in child-rearing practices, the mothers reflected on how the activities promoted in kindergarten reflect the skills that are needed in order to thrive, in order to survive in a particular socioeconomic and political context. And to illustrate this, I will show you a quote from a Greek mother who said this in her interview. In kindergarten, she meant in Norway. So in kindergarten, they prepare kids to be part of a social democratic society. You are going to be a member of society that's going to look after you, and you have to be like everyone else. So children play all day and learn to share, do things together. So the mothers discussed that in Norway, professionals promoted outdoor activities through which children would acquire skills like, for example, creativity, participation, teamwork, independence, skills that are needed in order to thrive in an egalitarian democratic society. And they discussed that the more adult-oriented activities that are more typical of kindergartens in their countries of origin mirror the set of skills that are thought to ensure children's futures in these countries. Like, for instance, more hard work or more discipline. This reflexivity about differences in child-rearing practices mirror how, for these mothers, parenting was contextual, was constructed as contextual. That is, as a set of practices aiming to ensure that children will thrive, that children will survive in a particular context. And of course, based on this, they were very critical and they questioned whether a universal parenting ideology can guide all parents and can help parents to teach their children skills that are required to thrive in a particular context. So raising their children in the context of migration was an opportunity for these mothers to redefine their own mothering, because they encounter and analyze diverse mothering ideals, and this led them to be very critical of both familiar and unfamiliar mothering practices. For instance, they would selectively incorporate some practices into their mothering, or they would reject others. But all in all, what I saw is that they would experience a transformation in their own mothering. For example, in the focus groups and in the interviews, the mothers criticized the lack of competition within Norwegian primary schools, where there is no a grading system based on exams, because these mothers, they were concerned that the focus on egalitarianism that they had encountered in Norwegian educational institutions wouldn't prepare their children to live and to survive in an unfair world. Because of course, for these mothers, I mean, I found this across all the data set, regardless of mother's social class, because all these mothers had experienced that the world is unfair. They had experiences with unemployment and corruption in Southern Europe, but also they had experienced so many challenges in Norway. Some of them, as I said before, even though they spoke Norwegian and they had university level education, they had not succeeded in finding a job in their professional fields. Others had experienced being unemployed for long periods, and others had experienced discrimination when applying for jobs in Norway. So based on these experiences, they doubt that this focus on egalitarianism could prepare their children to compete and to survive in real life. And at the same time, they express confidence about more adult-led approaches that they associated with their cultures of origin, like demanding more homework from children. And also, across all the data set, I saw that the mothers felt very proud of their cultures, and they pointed at positive aspects of their cultures on which they drew as resources to raise their children. And the Mediterranean diet would be an example, because this came up in all the interviews and focus groups as a resource on which they drew to raise their children in Norway as something they felt very proud of. So, as I said before, their experiences in Norway resulted in a transformation in their mothering. But it was very interesting to see that they realized about this transformation when they were in Southern Europe, maybe when they were on holidays, visiting their families, and then they realized that they gave more freedom or more space to their children, for example, than other parents do. So being in Norway, these mothers, they would say that they saw that they had an opportunity to interact with more dialogue-based, child-centered mothering practices, and they wanted to embrace these child-centered dialogue-based ideals because they considered them to be positive for their children. But at the same time, they were very critical, and they contextualized, they located these dialogue-based mothering ideals in a socioeconomic context. What does it mean? That the mothers, they would discuss that, okay, dialogue-based mothering practices are very popular in Norway, but this is not just because of the Norwegian culture. This is because dialogue-based mothering practices are very time-consuming, and therefore can be only performed in context of economic and welfare security that give parents the possibility to spend more time with their children, and also the possibility to patiently explain things to them. So then they would look back to their lives in their countries of origin when they became mothers, and they would discuss that because of the family and friendly working conditions and the low involvement of the state in welfare provision in Southern Europe, they had less time to spend with their children, and they had fewer opportunities to engage in this dialogue-based mothering. And they would say that in Norway, the majority of them, as I said before, those with middle-class occupations, they had encountered these family-friendly working conditions that allow them to spend more time with their children, and this helped them to embrace these dialogue-based ideals. But still, they would discuss that as migrants, they face some challenges related to migration, for instance, lack of family support. So then they would have like more challenges to live up to these ideals, to live up to these dialogue-based mothering as compared to Norwegian mothers who have more resources and more opportunity to live up to these ideals. So although, as I said before, these mothers, they were very critical towards parenting ideals, still they expressed that when they don't live up to these mothering ideals, they felt judged by Norwegian professionals or welfare state professionals, by the Norwegian community or the Norwegian parents. And to illustrate this, I will show now a quote from a focus group discussion where we can see a group of mothers who are discussing, who are sharing how people gave them dirty looks if they didn't engage in dialogue-based practices with their children, but they approached them in a more authoritarian way. So Agnes, she starts saying, Norwegian parents never scream or lose their temper. Sometimes I get really pissed off and I scream. Me too. Of course, I don't like it when I lose my temper. It's horrible. Imagine having a Norwegian husband. He never screams, and then you do, and he looks at you like, what's wrong with you? Do you really think that this is gonna work? That's everyday crisis. Exactly. Sometimes I get pissed off, I scream, and I think that in Italy, nobody would react to that. Nobody would say you are a bad mother because you scream to your children. They would say, I understand, you lose your temper. So in order to understand these feelings of being judged for not living up to mothering ideals, of course, we have to take into account that these mothers, they were observing child-rearing practices in Norway in public spaces and institutional encounters. I mean, they had fewer opportunities to see Norwegian parents in private spaces, Norwegian parents in real life, struggling with parenting. And this can reinforce this idealization of Norwegian parenting, this idea that Norwegian parents never scream. In my thesis, I also discussed that idealizing Norwegian parenting can be seen as a way through which these mothers negotiated their belonging and their otherness in Norway. Because we cannot forget that participants were mothers, but they were also migrants. And as such, they were represented in othering discourses in Norway as the other. So of course, these feelings of being judged for not living up to mothering ideals have also to do with power asymmetries and otherness that are typical of contexts of migration. So when these mothers said that people gave them a dirty look, it was more than an experience of being considered a deficient mother, but it was also a reminder of their outsider position in relation to the host society. So their otherness in Norway reinforced these feelings of being judged because they felt that they were seen as the other who challenges Norwegian notions of proper parenting. And actually this representation of the migrant parent as the other has been very apparent in public discourses in Norway, in societal and media discourses in Norway, as the other who performs inappropriate parenting practices. But these feelings of being judged have also to do, of course, with gender expectations of intensive parenting. I mean, motherhood is has strong moral connotations, and mothers are still considered the primarily responsible for children's well-being. And this includes closer scrutiny and closer monitoring of mothering than that of fathering. And there is so much research that has shown the negative emotional implications of trying to live up to mothering. We even have a term, the term of mother blame. Mother blame is a term that refers to these emotions of guilt that emerge from this image of the good mother. And research has also shown that even those mothers who are critical of intensive mothering, they still feel these negative emotional implications of trying to live up to this ideal. Research has also shown that fathers are more critical to expert knowledge on parenting. And this has, of course, to do with the fact that they encounter less scrutiny and monitoring. So they were very critical of mothering ideals, but they found it challenging to contest mothering ideals, particularly in the context of expert knowledge. So in their encounters with professionals in Norway, like teachers or community health nurses, the mothers experienced that they were raising their children in a country with particular child rearing norms that have explicit moral dimensions when these were expressed in professionals' practice. And this came up particularly with the topic of family leisure. And I will show you a quote from a focus group that illustrates this. So Sabrina begins, we are more collective. Okay, she means Southern Europeans. So we are more collective. The children are always with us, whatever we do, so we don't need to allocate time to them. You aren't doing anything specific for children. You do activities with children that you would normally do, like you would visit your family, they would play with their cousins. Here, it has to be planned around the child. In Italy, you don't have to plan. It's more like a natural thing. You are going out, you have dinner, the children are with you. In Norway, that would never happen because children go to bed at 7:30. And if you bring your children to dinner with you, you are seen as a horrible parent because you drink beer in front of your children. You are a horrible person. Yeah, because the child has to go to bed at 7. It seems that the more you go to the mountains, the better parent you are. So that was the sentence that gave the title of my publication, because I think that it really represents this clash in understandings of proper family leisure that the women were experiencing. So they were perceiving this clash in understanding of proper family leisure between Norway and Southern Europe, and they perceived that this involved moral judgments about their parenting. So they would discuss that for professionals, late bedtime, so putting the child to sleep after 7 p.m., or moderate alcohol consumption in front of children were seen as a risk to children's development. And there was an expectation that parents must protect their children from these dangers. The mothers, as we saw in the quote, they describe their countries of origin approach to family leisure as collective, meaning that the time that families spend together is experienced as something natural, because parents, they don't really need to plan in advance which activities they are gonna do to ensure that they are focused on the child, that the child will learn some important skills through these activities. And as you could see from the quote, they assessed, so this was assessed as a positive approach because it was not very demanding for them, but also because it would promote some positive outcomes for children, like the development of social skills, fun memories, and closeness in family. So when the mothers were having a discussion about this clash in understandings of proper family leisure, they also identified a clash in constructions of childhood. And they would discuss that in Norway, childhood is constructed as a social category that is separated from adulthood. So then there is this idea that children should be raised by being protected from risk from the adult world, like moderate alcohol consumption, late bedtimes. And this understanding of good childhood came as a surprise for them to some extent, because in their cultures of origin, in their countries of origin, parents are expected to facilitate their children's socialization into the adult world. And they would even highlight that it was also their responsibility to ensure that their children have good memories with their families, that they go to the wedding of their auntie, or that they spend time with their families, and also that their children develop social skills through interaction with others, like friends, aunties, cousins, grandparents. And the mothers, they shared that in Norway, there are some kinds of expert knowledge about family, about children, that are considered like non-negotiable. For instance, this, what I said before about advice on alcohol consumption and family leisure. So when this happened in these interactions with professionals, they would feel that their own knowledge was misrecognized, And some of the mothers, particularly those with working class backgrounds, they even felt a threat of professionals, positioning them as a risk to their children, and therefore making a referral to the child welfare services. So then when they felt like that, they would just play along. I mean, they wouldn't contest professional advice, but they would pretend that they agree with professionals. And something that I found very interesting is that when they were having this discussion on notions of proper family leisure, they also gave a critique to the work-family balance. So they would say that before migrating, when they were living in Southern Europe, they faced many challenges to achieve the work-family balance. And in Norway, those mothers with middle-class jobs experienced more family-friendly working conditions that made it possible for them to reconcile motherhood with their careers. However, they didn't always experience that these flexible working schedules were the solution to the work-family imbalance, because the time that they were not working was still experienced as burdensome to some extent because of all the demands on their mothering. And I think that these experiences, I think that these reflections and these insights from these mothers can make a great contribution to the very needed debate on the work-family balance. Because as Frank Furedi, he's a sociologist, and he discussed that in the last decade, so family policies have addressed the working conditions of parents, assuming that family-friendly working schedules would be the solution to the work-family balance. But we also need to pay attention to this intensification of parenting and the demands that this is putting on parents' free time. Because it doesn't matter if we give more free time to parents, if they are going to face more and more demands on their parenting, then this time would be experienced as burdensome to some extent. So
Raquel,
very short. Yeah.
Forgive me for interrupting you. If you can go back to the previous slide, there's something not fully clear to me. Playing along with professionals, are you talking of families that are referred to the child welfare service, or what kind of professionals do you have in mind here?
Yeah, none of my participants had any experience with the child welfare services. Mm-hmm. So I mean, when they interacted with welfare state professionals, like for example, teachers in kindergarten, teachers in a school, or hälsosöster, like community health nurse. Mm-hmm. And when they, in this interaction, there was this advice on children's bedtimes, family leisure, like moderate alcohol consumption. The parents, some of the parents, especially those from working class backgrounds, they would feel that their knowledge was misrecognized, and they would feel fear because they would feel fear to be positioned as a risk to their children's well-being. And then, you know, like this possibility that these professionals, teachers, community health nurses may make a referral to the child welfare services.
Thank you, it's clear.
Yeah.
Thank you.
So then playing along, I mean that they wouldn't contest the advice that they were receiving. They would just play along like, yes, I agree with you. Yeah. Great. So very short conclusion. So as I said, doing mothering in migration brought opportunities for these women to achieve the work-family balance and gender equality and involve motherhood. Of course, as I said before, for those with middle-class occupations. And also to interact with these dialogue-based child-centered mothering ideals. Migration prompted a transformation in their mothering practices for these women because they were in this position from which they were very critical towards familiar and unfamiliar practices. But still, they also perceive moral judgments. As I said before, especially with this topic of family leisure, and they experience that professionals identified risks related to their lifestyle choices, like alcohol consumption, the late bedtimes, as risk to children's well-being. And although they were critical of parenting ideals, they found it challenging to contest parenting ideas, especially in the context of expert knowledge, because of these power dynamics. So that was it. And now I have very few slides about mothering in migration during COVID-19 pandemic. So in order to present this topic, I will draw on data from InCovid Norge, that is a research project I've been participating in. So InCovid Norge is a research project that was initiated by the University of Bergen in cooperation with other institutions in response to the pandemic. And it had a quantitative and a qualitative component. And as for the latter, we did interviews in April and May 2020, so very at the beginning of the outbreak of the virus in Norway. And we did interviews with 26 men and 29 women coming from Somalia, Syria, Sri Lanka, Chile, and Poland. And I must say that motherhood or parenthood were not the focus of InCovid Norge, but we asked questions to our participants about sources of information about the pandemic, their knowledge of and their opinions about the Norwegian authorities' recommendations to stop the spread of the virus, and also about the psychological impact of the pandemic. So based on this project and the literature, I will briefly present some considerations about the challenges and the opportunities that COVID-19 can create for mothering in migration. Yeah, so in Norway, on March 12, 2020, the government issued the strictest measures in peacetime. We had significant restrictions on social contact and movement and also border controls, but we didn't experience a complete lockdown like many other countries in Europe experienced. On April 8, 2020, the government decided to ease this restriction gradually. An example of this was the reopening of schools and kindergartens, like already April, May 2020. So very early if we compare it to other European countries. And regarding these restrictions, I would like to highlight the traveling restrictions because these have enormous implications for migrant mothers who may count on the help from transnational care networks like grandparents who come to help them with the care of their children. So in Norway, there were 2 occasions that the borders were completely closed. So this means that foreign nationals who have partners or who have family residing in Norway, they couldn't enter the country, like grandparents, even boyfriends and girlfriends, they couldn't enter Norway. And the borders remain closed for longer period for those coming from outside Europe. And then, of course, when the borders opened, there was a time when visitors had to do quarantine. And sometimes there was a time when they could do quarantine at home, but also for some period they had to do quarantine at a hotel. And of course, this involved economic cost. So what I want to say is that this situation, these traveling restrictions had enormous implications, affected a lot migrant mothers and also their children who spent long period without seeing grandparents or aunties, or other relatives. So in Norway during the pandemic, the migrants have been overrepresented in rates of infections and hospitalizations. And explanations for this include crowded housing condition, low income, and also the type of occupation, because migrants are usually working in essential jobs like healthcare, educational institutions, also cleaning, transport, like taxi drivers. So all these are factors that may increase their exposure to the virus and also that may hinder them from protecting themselves from the virus. And also during the pandemic, there were some media and societal discourses that blame migrants for the import and the rapid spread of the virus. And this, of course, contributed to stigma and misinformation. So regarding parenting during the pandemic, in Norway, families felt that the help they needed was not good enough or not available at the very beginning of the pandemic. Of course, they experienced more stressors to do parenting, to raise their children during this period. We are talking about home office, the physical distancing protocols and economic uncertainty for many families. And research has shown that unemployed parents and also parents with mental health conditions are two groups that have experienced higher levels of parental burnout. It's true that there are some families and some parents who reported having experienced a positive interaction within the family during the pandemic, so who saw the pandemic as an opportunity to spend more quality time with their children. But we cannot forget that this romanticization of the pandemic and romanticization of the quarantine is a class privilege, and that of course those families who have a big house, economic stability, and working conditions that are more family friendly can see this as an opportunity to spend more quality time with their children. So drawing on the data from In COVID Norway, I would like to say that, of course, our participants were migrants. So this means that they had family members living abroad. And this was another stressor for them because they were very worried for the health of their relatives back in their home country, especially when they came from countries that were facing a lot of challenges to successfully respond to the pandemic. And many of them would feel like even responsible to some extent to try to take care of the health of the relatives back in the home countries. And to do so, they would share the Norwegian authorities' recommendations with the relatives who were living abroad, especially when there is a contradictory information regarding the preventive measures between their home countries and Norway. So this resulted in more stress. It was like a double burden because they were like taking care of their children and dealing with the pandemic here, but at the same time, they had this concern and stress about their family back home. And of course, this uncertainty about when they would be able to visit them or to see them, especially those who come from outside Europe. As I said before, I did the interviews at the very beginning of the pandemic, like the first 2 months, when children schools were closed. And for some of our participants, those who had like middle class jobs and who had like economic stability, it's true that they reported that the pandemic brought also opportunities to enjoy motherhood, to enjoy like the fun side, the intimate side of motherhood, the everyday. Also because they felt that there were like fewer expectations on them as parents, and they had fewer interactions with professionals. But I think that this also has to do with the fact that it was like the very beginning of the pandemic. As we all know, the pandemic has lasted for so long, for longer than we expected. So it's been like 2 years already. And this means like more home office, more uncertainty, that of course makes parenting more stressful. Because after the interviews, when schools reopen and kindergarten reopen, okay, like even they were open again, if there was a child who was sick in the class, all children were sent back home, right? So then this makes parenting very challenging because it's like planning and uncertain every day. So this brings, of course, more stress. So that was it. As I said, we didn't explore mothering or parenting in this project in COVID Norge. And there is not literature on migrant mothering during the pandemic, but I hope that these insights may be interesting and useful to have a discussion now. So thank you very much for your attention.
Thank you, Raquel. That was really interesting and very fascinating research and very original as well. So I absolutely enjoyed it.
Thank you.
Now I'm opening the floor for questions from our audience. We have about 20 minutes. You can also write in the chat, and to our Greek public, you can write in Greek. Others with, I can't read Greek, but others can. I see Nelly has raised her hand.
Yes, thank you very much for the lecture. It was very interesting. I was trying to think about what you presented from the perspective of the experience of motherhood in Greece. And I was thinking that, and I mean, I have some comments and also some questions, and which you might find useful. The first thing is that in Greece, motherhood is, I think, in my experience at least, is already very intensified, extremely intensified. I mean, this is partly because of the fact that there is a lot of emphasis on out-of-school activities. So basically, mothers, especially, but also fathers to a lesser extent, they have to make sure that children have private lessons, whether it is sports or language lessons or lessons to support different subjects that are taught in school. So you have also a lot of private tuition, for example, in maths, physics, ancient Greek, etc. So motherhood in Greece, in my experience at least, is extremely intensified because of that, because the educational system is so intensified and it involves so much out-of-school activity that it is very difficult for parents to actually find time, quality time, what you described as quality time with their children. And to me, it was really strange to hear that mothers from South Europe, I don't know what the situation is in Spain or Italy, but it was really strange to hear that mothers were not relieved by the fact that they didn't have to spend so much time taking their children to different private tuition lessons or sports or whatever, but also helping them with homework. And they were actually asking for more homework. They were asking for more grades at school. It seems to me like a very strange reaction, but on the other hand, I can understand it because I think that we've been brought up in a system that valorizes a lot torturing children at school, basically, with lots of very difficult teaching practices. So, for example, in Greek schools, there's a lot of learning things by heart. This is still considered very important. Which I know that in Norway, for example, is no longer considered as such an important skill to have. But in Greece, memorizing and learning things by heart is still considered one of the most important skills that one can take. So for me, from my perspective at least, and I wanted your comment on that as well, it's really weird why mothers would actually want to have to go back to this system, which is much more intensified in terms of motherhood, of what motherhood means. It means basically that mothers have to, in Greece at least, it means mothers have to spend, when they finish their jobs, they have to spend most of their time helping their children or taking their children to tuition classes and etc. So this is the first thing. And the second thing is, I mean, with the pandemic, what we saw with the pandemic is that there were social inequalities, of course, in terms of how motherhood and parenthood in general was experienced. But we also saw that there were some types of feminized occupations, like people who are working in hospitals or people who are working cleaning, continuing to work, who faced special challenges. And I was wondering if in the sample that you had, because very often these types of occupations involve migrant work, if you had any people who were actually, any mothers who actually, or fathers who actually continued working during the pandemic, and what was the experience for them? These are my questions. I hope they are.
Thank you.
And my comments also.
And thank you so much for your comments. Really, I'm so looking forward to comments from the Greek audience, really. This is a really nice opportunity for me too. So yeah, so regarding what you said, the mothers, they didn't want to go back to the educational system that you have in Greece. Actually, and now, you know, I'm remembering like so many interviews that I have with them. Now I remember an interview I had with a Greek mother that I call her Linda, and she would say, what you mentioned, that in Greece is incredible, like all the demands we put on children, and I feel sorry for that. And she would remember like her own childhood and how stressed she felt. So they were very critical of that, and they didn't want to go back to that educational system. They were especially happy and satisfied with kindergartens in Norway, even though, of course, at the beginning it's a shock, right? Like you are coming from one educational system and then you move here, and kindergartens here, as I said before, is like these forest schools. Children are outdoor, even though it's raining, snowing, engaging all the time in these excursions, exploring nature. So the beginning is like a shock, and some of them were like even very afraid of their children getting sick, or but after getting over that shock, they were very satisfied and very happy with kindergartens, because they had this opinion that children should play. But then when children started going to schools, and they realized that here in Norway there is not a great system based on exams in primary schools. I'm not sure about when children start having exams. Maybe the Norwegians here can help me with that. I'm not sure if it's like in middle school or high school. So then
it's in middle school. It's in middle school. They don't get any grades when they are in primary school until middle school, I think. Primary and middle school, you don't get grades. You get feedback, but not.
So then this was interpreted by the mothers like. So then it was when they started to feel a little bit of concern. Actually, I remember that after a focus group discussion, I had lunch with the mothers, and I'm teaching at the university, and several of them would ask me, what do you think, Raquel, about your students? Are they well prepared? Because how can they be prepared when they have studied like many years without this competition that we are used to? So it's not that they wanted to go back to their educational system. It's not that they wanted their children to enroll these private lessons or tuitions. No, they were very happy that their children have more free time to play and to do things that they like. But they were a little bit concerned about the low demands on their children, especially in primary middle school. But of course, so they show their concern, but at the same time, as I show in the presentation, they were very critical, and they when they criticize, for instance, the Greek, the Spanish, the Italian, the Portuguese educational system, they would say like, we don't like that and we don't agree with that, but at the same time they located it in a wider socioeconomic political context, and they would say like, okay, I understand that children there engage in so many private lessons, and they engage in more adult-led activities, and also like competition, like they have some contest, because through these activities we are teaching children some skills that are maybe important for them in order to thrive in Southern European countries. So I found that like also very, very interesting. And they would say also that they would say like the opposite. So they would say that they understand that being in Norway and being a student here in Norway and not having all this competition, all these exams, all these contests, they would understand that their children would be prepared if they stayed in Norway and if they were Norwegians. But of course, this egalitarian Norway for many of them was an ideal, because many of them, even though they were living in Norway, they had experienced so many challenges to get a job or to access the family-friendly working conditions. So so then they were more critical of that. And then regarding your second comment regarding this feminized occupation, yes, actually I remember now an interview with a woman who she was working in a cleaning agency. And of course, this was an essential job, right? So at that time, kindergartens and schools were closed, but she had to work. And her husband also worked in the same cleaning agency. So then they had like some lessons for children whose parents were working in these essential occupations, essential jobs. And of course, you also see that in health sector. That is also very feminicide, right? That there are many women and many migrants working in the health sector in Norway. Yeah. Thank you for the comment.
Many thanks. I see a raised hand and I have a question myself. Maria, would you like to go first?
Yes,
or would you like me to go first? Yeah.
No, I'll be very short. Thank you very much. I really enjoyed the lecture. It is, as Sofia said, it is a quite interesting and let's say extraordinary issue. So it combines migrant question, but also mothering, and I found it very, very interesting. And thank you very much for the extensive report of your thesis that you gave us today. My question is, what about fathering? I mean, of course, it is not your topic, fathering, but through the narrative of women and all these changes of how they deal with their children and how they deal with themselves also, I understand, because it's a new relationship with children in a new context of more egalitarian, objectively, let's say, society. Do we have any information about how fathering changed, or the relation of mothers with fathers has changed, or has new? Because for us, as we all know, Norway is a society where equality between women and men is much more advanced. So what about that? Because coming from Greece, where you have fathers who do not participate at all in home, in tasks at home, and real in the care of children, is it a change? Question about fathering?
Thank you. Yes, a very important comment. So actually, in my doctoral project, I explore both, or like my aim was to explore parenting, so mothering and fathering. But you know, this gender character of parenting came up like very at the beginning of my doctoral project. So I tried to recruit both fathers and mothers, but I found it very difficult to recruit fathers. I ended up only with 5 fathers. I would go to social events organized by Greeks, Italians, Portuguese, Spanish, and I would introduce my project to all of them. Like, this is a project about migrant parenting. And I remember some men would refer me to their wives because they would say, yes, it's about parenting. So, you know, like, my wife is the one who can better answer your questions and give you better information. So it was very clear that this was a gender experience and that there are gender expectations. Now, like, thinking about the data I collected from the fathers, I would say that all of them talk about this gender equality, and all of them would feel like very satisfied and happy to be in Norway, especially regarding this parental leave, like the parental quota. Because of course, like in Spain at that time, it was ridiculous. I think it was like 2-3 weeks. So like coming to a country where you have like so many weeks, for them it was like very positive, and they would talk about this, and they would stress like how important was for them regarding like creating a bond with the newborns and with their babies, and also like getting to know better their babies from the very beginning, and also sharing this with their wives. So for men, like, this gender equality came up in all the interviews with men. And then regarding the data I collected from the mothers, they didn't speak so much about gender equality, which, I mean, they did, but not as much as men. All men spoke about gender equality, and I think this is very interesting, right? So maybe they were not experiencing so much gender equality. But also what I see is that in the interviews and focus group discussions that I conducted with the mothers, this experience of mother blame came up a lot, and this didn't came up in the interviews with the fathers. So I remember this Greek mother, Linda, when she came to my office to be interviewed, I remember that she would tell me that because she had a baby and she would feel guilty for having left the baby at home with her husband, even though it was, of course, completely fine for the husband. He was the one who had offered. But, you know, like these feelings of blame and of guilt that are so strong and that are so difficult to avoid when these expectations on mothering are so strong and so gender. Yeah, that came up a lot. Like, so those negative emotional implications came up more, yeah, in the data from the women. Then regarding changes, I mean, transformation in gender relations, the majority of participants, they had built their families in Norway. So in a way, they didn't reflect so much about this transformation because it was like the first time they became parents, they were already in this country, right? For the others, yes, I mean, the fathers, they would say that they would interact now more with their children, and they would be more involved in their children's upbringing, and they would realize about this when they went on holidays to Southern Europe. They would say, like, you know, it's very, I remember 2 fathers were for a year in Southern Europe when they have the parental leave, and they went to the kindergarten in Southern Europe, and they would be shocked because maybe they were like the only father in the kindergarten or attending to the meetings. So these things were like a shock for them, but they experienced it as something positive, as something that was contributing positively to the relationship interactions with their children, and also, yeah, to their lives, because, yeah, they like feeling involved. Yeah.
Thank you very much. It's very
Thank you.
Thank you.
I will ask a question myself, even though we don't have much time. Did anything came up in your interviews about what is considered appropriate and inappropriate expression of affection and reinforcement? What are how to express affection? What is what is perceived as a socially acceptable or not socially acceptable way to express affection to your children in Norway, and to give them reinforcement in general, emotional reinforcement?
Affection in Norway.
What was the perception of the people you interviewed about their how they normally interact with their children, not in terms of yelling, which is something that, but in terms of giving them affection, and giving them reinforcement, like, I love you, you're doing great, you're wonderful. What was considered too little, too much, appropriate, inappropriate? Was that brought up in the interviews at all?
Okay, so when they talk about Norwegian mothering ideals from their perspectives, they really stress this dialogue-based approach. So, like, really sitting down with the child, like looking him or her to the eyes and really like explaining him or her something, you know, like really spending time to patiently explain things to her. And I remember now a focus group discussion where there was a group of mothers who were working in a kindergarten. So then, of course, they had the opportunity to see childbearing practices with babies or with children who were very young age. And they would say that in Norway, they had experienced something that for them was a shock. And it's that even though the child is very small, you approach him as an individual who is independent, who has own desires, own wishes, own needs. So then, even though I remember this quote that this mother was saying, I was feeding a baby, she said, no, I don't want more. So you don't force him or her, because it's like we have to respect, like, so this idea of individuality, children have own needs, own wishes, and we have to respect that. That was like very, very central. Also, this idea about dialogue based. So we engage in conversation, we engage in dialogue with children, even though they are so small. We need to spend time reason with them, like explain things to them. And then regarding like affection, like in more, how can I say, like expressions of affection, like in more physical terms.
Yeah, physical and also verbal affectional reinforcement that doesn't really beyond, I mean, rational dialogue or explaining things or being patient.
Yeah, regarding verbal, they also stress this, how can I say, like this, talking about emotions and feelings, you know, like recognizing the child's emotions and trying to explain them to him or to her, like, I understand you are sad, this is really recognizing, acknowledging this emotional side. Physical, they didn't really say that much. The only thing was it was like the opposite. So they would say that when they feel guilty, when they feel bad because they don't live up to this dialogue-based mothering ideal as Norwegian mothers do, they would remind themselves that they hug their children more, and they show their affection and their love in these physical terms. So then you can understand by that they represented, that they perceive Norwegians are as more, as not showing affection in these physical terms, maybe. Because they would feel proud, because as Southern Europeans, we hug our children more, and we are like more, we show love more.
Any of them who felt judged negatively on that basis, of emotional expression?
No.
No? Okay.
They would say, now there are many moments of the interviews coming to my head, and they would say that, for example, after being so many months in Spain, when they came back to Norway, their children would notice like this clash, because in Spain it would be very common that when they were on the street, people would say compliments to the children, like, you are so cute, or look at you. And then when they came here, so they had this perception of Norwegians as cold, and that even the children would feel like but no, they didn't feel judged, or they didn't feel they didn't have any experiences of these dirty looks for how they physically express their affection and their love to their children.
Thank you.
Welcome.
Okay, now in theory we should close, but this is so interesting. I don't know if anybody has a final question. I don't see any raised hands. Okay, yes, in the chat. Any hints on the effects of the pandemic? Just curious if migrant families got to interact with Nordic families or other migrant families. So social interaction under the pandemic.
Social interactions. Yes, I remember that in many of the interviews, it came up that they had fewer interactions with their neighbors. Many of them would say that, like, we have this perception that Norwegians are cold, and now during the pandemic, because of these social distancing protocols, it is even like more difficult for us to find these spaces where we can interact. So more like isolation, if you can say. But of course, as I said before, like, the interviews were conducted at the very beginning of the outbreak of the virus in Norway, when there was so much fear and social distancing protocols were very strict. This may have been different. These experiences may have been different afterwards, when the measures eased.
Yes. Yes. I know I should close this. Such a shame, though. Okay, I think there are no more questions. Now maybe Maria or Siri want to say something, some closing words, some closing remarks, or Nelly, who are leading this project for NTNU and for Panteion, respectively. If there's nothing in particular, then I think we should close this very interesting question time after your lecture. Many thanks for a very fascinating presentation and for a very interesting discussion. And thanks to the people who asked questions. from the public and from the attendants. And please follow the ProGender website that has already been posted in the chat for new events. And there's also a Facebook page that you can follow. We have plenty of digital events that can easily be followed from multiple locations at convenient times for everyone. Thanks again. Thank you.
Thank you. Thank you for inviting me. Thank you.
Raquel.
Bye.
Bye.